Right, I want to welcome everybody today to our Fund the Fellow, where we're going to be talking about exercise, nutrition, therapies. We have a great panelist today that I'm going to introduce in a few moments, but I just really would like to welcome the Fund the Fellow Foundation family. It's really a pleasure and honor to be with you tonight and to be with these great panelists. Once again, it's always my pleasure to thank Janice and Rick Shenna, who really helped me begin this program to really educate our future neurologists into movement disorders. And thank to all the great work from the development team at Georgetown University Medical Center for supporting us. And thank you for all your support over the years. And our mission is really to train fellows, to train more movement disorder physicians, not only in our local community, but throughout the entire country. And so far, we've been very successful since having a fellowship program that we were able to begin back in 2005. But now with the Fund the Fellow, we've really been able to expedite and increase the number of fellows that we have produced not only here at Georgetown University Medical Center, but really throughout the entire country. You know, when I was a resident and I graduated back in 2000 from the neurology residency training program, I was probably only the third resident ever really to go into movement disorders and the second person to actually do a movement disorders fellowship, you know, from 50 years of having a residency program. And now since 2003, and because of Fund the Fellow, we have had 32 residents, 32 residents go on to do a fellowship program with us here at Georgetown University Hospital. So we've trained 32 movement disorder fellows now who've gone on to become movement disorder specialists. And we've also influenced 10 other residents to go on to develop into other movement disorder programs throughout the country. So we're really excited about what we've accomplished. We really are very grateful for all the contributions that we've got to be able to develop these young men and women who have interest in taking care of patients with Parkinson's related disorder, and other neurodegenerative disorders. And it's really been a pleasure and honor to train them and to train the next generation of movement disorder specialists. Again, this is not supported by federal governments. There's no federal funding for people who want to develop into a movement disorder specialist, and only 25% or less of individuals with movement disorders actually ever get to see a movement disorder specialist. So there's just not enough of us around. So this is an area that we definitely have to continue to grow. And because of the fellowship program, not only do we create more specialists in our area, but we also do a lot of research. And then we also get to know our allied health professionals. So we definitely know that it definitely does take a village to treat patients with movement disorder problems, and we're learning a lot about them. And the neurologist is only one important role. So now, with that introduction, again, thanks for being here tonight. I want to introduce our panel, and I'll introduce them as they appear on my schedule. On my screen. So first, I'm going to just state who they are, but I'd like them to each just say a few words of what their area of expertise and how long they've been involved in helping individuals with Parkinson's disease. So I'm going to begin first with Karen Edick, who's our speech pathologist, and she was with me when we first began the program, day number one, becoming a center of excellence, and she's attended the different allied team training programs with me and my team over the years. So Karen, you're on mute, but if you can please introduce yourself and just give a little bit overview of what you do in our program.
Thank you so much. It's so nice to be here. So I've been at Georgetown since 2002, and I feel like it's been such a great experience. I remember back in the day, really working with patients on the floors and really building an outpatient program here at Georgetown. The allied team training that we attended actually in Florida and in Arlington, Virginia, was really fundamental, I think, to build a strong, cohesive team that we have today and that reaches so many individuals with Parkinson's. So it's wonderful to be here, and thank you so much for having me.
Thank you for being with us this evening. Thank you. Lisa Ebb-Chesky has been also with since we started the movement disorder program, and has been there from day number one as well with us. She's a physical therapist, and we'll open up the floor if you can make a nice introduction for everybody.
Sure. Hello. Thank you, Dr. Pagan. It's so nice to see some actually former patients on the list that also can speak to the physical therapy and the allied health services that they've received here at Georgetown. I've been a physical therapist for almost 20 years now. I'm board certified in neurology and have advanced certifications in LSVT big and power. Really 100% of my schedule, I see people with neurodegenerative disorders. It's great to be here tonight and hopefully to provide you a lot more information about how we do PT and allied health services here at Georgetown.
And our next panelist, she is part of the Fund to Fellow family. She's been with our Fund to Fellow program since the beginning, and she takes care of a lot of our patients with movement disorders, and she's a massage therapist. Lisa Syed.
Thank you, Dr. Pagan. I'm honored to be a part of this panel, first of all, and I'm grateful to both Rick Shenna and Janice Buchanan for introducing me to you, Dr. Pagan, and to the whole Fund to Fellow family. It's been really just so inspiring. I've been a nurse massage therapist for quite a long time, over 30 years, and as experience as an RN. I had 6 years of clinical experience with the National Rehabilitation Hospital. Then I transitioned into the pharmaceutical industry, and I was doing clinical research for 3.5 years, working as a monitor for clinical drug studies. So I collected a lot of data for Alzheimer's and peripheral disease studies. And that was my little segue. I was missing that patient contact and that immediate gratification that I got as a registered nurse in making a difference. And that inspired me to pursue a career in massage therapy, because I thought it would be a nice way to pool my nursing experience and my desire to really impact lives, like immediately, rather than waiting for a drug to get through a long chain. But I am really grateful for the opportunity to work as a medical massage therapist, in the sense that I do work off of doctor's prescriptions for my work. And a lot of the clients and patients that I see have I treat a lot of Parkinsons, many who are probably on tonight, and I specialize in those with disorders of both motor as well as sports injuries, rehabilitative needs, and basically that's my niche, though, but is the medical massage.
Well, thank you for joining us this evening. And lastly, Chris Callahan, who is a personal trainer. I've heard a lot of great things about him, so thank you for coming today. And if you can give us a little overview of some of the things you specialize in.
Well, thanks for having me. I came here from Virginia Tech. I was the coordinator of the cardiac rehab program there. So I was working with clinical populations. So I came up here and worked as a personal trainer for the past 20 years. And probably in the last 10 years, I've been seeing more Parkinson's patients. So I've got a broad familiarity with a variety of disease states. And that's how I got here. I got here, I know Janice, and she's connected me with your group. So it's a pleasure to be here.
Well, thank you all again for being here with us. So we're going to first start talking about some of the things that you do. And we're going to start with Lisa first, and talk a little bit about how COVID has changed physical therapy a little bit. And, how do you do physical therapy from a computer? I'm sure about this. Can you tell us a little bit about how you're doing this nowadays?
Sure. So you can do physical therapy over a computer. I probably spend out of my 40-hour week, I probably spend 30 hours on a computer, which, was, when I went to PT school, I don't think I'd ever imagined doing physical therapy over a computer. But in some ways, I think telehealth has given us more benefit to seeing people in their own home environment, really seeing how people move in their bedroom, their bathroom, around their house, and really seeing, identifying areas of need that we might not see in the clinic because of the setting that we have here. I've had a lot of people that just dial in themselves, or they have a care partner help them, but you really don't need any fancy equipment. I think, just being present and following our instructions as far as exercise and balance and walking, and there are limitations granted over telehealth, but I feel like it's really been eye-opening for me and some of my patients, and I feel like I've actually had more benefit for telehealth for some people, that it's also difficult for them to get here to Georgetown.
Yeah, no, and I think that's absolutely true. That there is a silver lining, and especially if there's a silver lining, I think it's also probably been not only in physical therapy, not having to come in, find an appointment. You probably save an hour on both bookends.
Oh, definitely.
And come back, especially coming to a busy place like Georgetown. But how about in speech therapy, Karen? I now tell patients, you can do speech therapy, the Loud program, for example, potentially through this mechanism, through Zoom, or using these telehealth type appointments. So how has COVID changed that? And can you also do potentially cognitive therapy through Zoom as well, or one of these platforms? You're on mute still, sorry.
Okay, all right. So right now I am seeing a majority of patients through telehealth, which has been fantastic. It's great to be in people's homes, having increased access to caregivers to provide education. In terms of doing voice therapy, we are doing voice therapy through telehealth and also cognitive therapy as well. Unfortunately, swallowing evaluations and therapy are not covered by most insurers, unfortunately, so they need to be in-person appointments. But in terms of cognitive therapy and voice therapy, we're doing that, and it's been wonderful. As Lisa, alluded to earlier, people are coming in and they're getting therapy done without that travel time, without the inconvenience of that, and it's been amazing.
Excellent. So COVID has brought in, being through the pandemic, going through the pandemic has brought some challenges, because sometimes patients are a little concerned about going to a therapy center, or some people coming to the house. So Lisa Sayegh, how have you handled the pandemic to be able to do massage therapies? Because that's something that probably requires more of a hands-on approach. So how have you, what have been some of the challenges, and how have you overcome those challenges to get the massage therapy to some of our patients who really need it?
Well, that's a good question. Actually, I have not overcome it yet. I'm in the process of trying to find my way through it and navigate, but it is a work in process or in progress. I have continued, I'm in a bit of a transition in my practice, in that I am changing studios. So the impact of COVID on my practice has been a little heavier. I wasn't expecting that. I'm making some major decisions, but I am now doing more of a home visit, but I am choosing, the right environment. I'm making sure that I totally abide by all the necessary CDC guidelines. That's critical to me. I have my mother at my home right now, so I have to be a little bit more, she's 92. So, I'm not working in that heavy load like I was before. I was seeing easily 24 to 35 clients a week. I have reduced that tremendously because COVID, the 1 a day or 2 a day, and providing just the safety, because a lot of my client population have already compromised immune systems. So many of them have opted to stay home and not be exposed to, a practice at this time. So I really have encouraged all my clients or my patients to really be a part of more of a meditation. I have created a blog that I'm trying to incorporate to guide people on ways to relax their nervous system and calm their nervous system, because that is primarily my focus, especially with Parkinson's. They need to kind of relax their muscles, but also their mind. And because of the body-mind connection, really the meditation and the ways that we could focus on our breath is extremely powerful. So my practice is probably less manual now. And until we kind of come out of this COVID, just this fragile time, and really doing more kind of meditation or wellness through the distance of, the computers.
So staying safe. So you've also adapted in using a little bit more telehealth type measures.
Absolutely, yeah. Mm-hmm.
And Chris, so one of the common questions I get is, well, what's the difference between a physical therapist and a personal trainer? And as a trainer, what do you think are some of the best exercises that you see your Parkinson's patients do?
So the kind of shorthand between the difference between a physical therapist and a personal trainer. A personal trainer does a lot of kind of coaching, and you're right there with the person, probably more frequently than a physical therapist can see them. You're helping keep them safe, because you'll learn an exercise from a physical therapist, you'll get home and you won't remember the form. So you got to keep proper form in mind. I work with a physical therapist. Somebody will come to me with their program from a PT, and I'll help them through it and make sure they're doing it correct. But some of the exercises that are most beneficial, what's interesting, there's a variety of things you can do. They've shown just 7 days a week of exercise. The more days of the week that you exercise, the slower the disease progression. And then a variety of exercises. So if you're walking and strength training, or doing the big program, boxing programs, Tai Chi, dance, there's all different types of exercises help. But it looks like the most important thing is to get out there, 7 days a week if you can.
Excellent. And Lisa, the difference between a physical therapist and a personal trainer is also probably a question you get asked a lot as well. And I've known for you to work with personal trainers on occasion. So,
I do, yes.
So can you tell us some of the interactions sometimes you have with personal trainers and what you may do a little bit differently than they do?
Yeah, so I just to piggyback on what Chris said, I love working with personal trainers. I think Chris is right. We create and devise a specific exercise program, and then the trainer is able to help out more on a regular basis, making sure the technique is correct, the form is correct. I work with a ton of personal trainers, and I always encourage the patient to connect me with the personal trainer so I can chat with them over email. I just did that the other day with someone. I said, you know what, this person's doing great with their posture exercises. Let's change it to this exercise now. And just, having that strong relationship between the person with Parkinson's, the trainer, and the PT is so important just for, again, slowing down the progression. Like Chris said, it's about intensity, repetition, and frequency of exercise 7 days a week. There's no certain specific, I must do this exercise for my Parkinson's. It's a whole cornucopia of exercises. You want cardio, you want strength training, you want core, but really it's that intensity, frequency, and repetition that you want.
And you both are absolutely correct. The one common theme that keeps coming up in Parkinson's research is the importance of exercise, importance of aerobic exercise, and how these nerve growth factors, these endorphins, increase after a set amount of time of exercise. And that's what we're trying to do in research. We're trying to use all these fancy tools, all these fancy medicines and gene therapies to try to increase these nerve growth factors, but one could do it naturally without putting anything foreign into your body by exercising every day. And our patients who do exercise on a regular basis just tell us how good they feel. And we once did a small research project just with patients going through the Big and Loud program. And Lisa was presented this at one of our national meetings, that it looked like I doubled their medications, right, Lisa? And
Yeah.
their disability reduced by over half. And it's like if I had just increased their medicines, and we hadn't. So we definitely have learned a lot through research, and this exercise is extremely important, and every single trial continues to pinpoint to that. Now, moving a little bit into the speech therapy field, in terms of swallowing issues for our Parkinson's patients, Karen, how do you evaluate them, and what are some of the techniques that you can do or to help our Parkinson's patients swallow better and more safely?
Mm-hmm.
You're on mute again.
Sorry about that. Okay. So in terms of evaluation, I always think evaluation early on is very critical. At a minimum, we get information about baseline level of functioning, which I think is really important throughout the person's progression with Parkinson's disease. So I tend to do an in-office swallowing evaluation and or a modified barium swallow study to get imaging of the oral and the pharyngeal phases of swallowing. And then once we have that information, we can talk about therapeutic approaches that would help individuals swallow more safely. In general, some strategies that help most people when they are having some difficulties is to decrease distractions. When you're eating and drinking, just eat and drink. Don't try to have a conversation. Try to reduce environmental backgrounds. Go slowly, take small bites and sips. But it's very important, if you have concerns, to be evaluated.
Thank you so much. Lisa, actually, Chris first. I want to go back to different types of exercises. What is Tai Chi, and is Tai Chi beneficial for Parkinson's disease?
Yeah, so Tai Chi is it's a martial art, but if you watch it, you see the commercials with people doing Tai Chi. It looks like a slow dance, and there's a really meditative aspect to it. So you're getting benefits, kind of brain benefits, and in addition to just the exercise benefits. Some of the benefits for Parkinson's are the fact that you're going through large ranges of motion with a lot of the joints in your body, and you're focusing on staying rooted. So it works on your balance centers as well. And it's very gentle. So if you're having, joint problems, you can go through a Tai Chi form without, stressing yourself. It's interesting because it's kind of different than the vigorous programs that are also show benefit. So it's kind of benefits from both sides if you look at the exercise spectrum.
Yeah, absolutely. I've done some maneuvers and I start sweating when I do Tai Chi. So you are definitely it's more like isometric. So you are contracting all the muscles. It looks slow, but it is exercise. I've put up a good sweat when I've attended some of these meetings, and they've taught us a little bit of how to do Tai Chi. And you're absolutely right. A lot of research has shown that it can really improve in balance. And a lot of times when I am seeing some of my patients having more balance problems, I do recommend Tai Chi. And I think it is something that could be really helpful. So I think you're absolutely right, Chris. Lisa, going back a little bit to massage therapy, how can massage therapy help individuals with Parkinson's disease?
Well, I answer that by how is it impacting? How does Parkinson's impact the quality of life of an individual? And there are several areas, obviously motor. So the physical, the rigidity and the rigidity and dystonia that a Parkinson's patient often experiences is extremely painful to the body. And the purpose and intent of a massage therapist is to calm the nervous system. So I find my studio, which is in transition, but the studio space, for instance, it has to be very soothing and quiet to begin with. I have found that having a person have a respite, because I look at the Parkinson's, the patient who has like this muscle contracture, involuntary, you can't relax it. So it's ongoing and constant between the dyskinesia as well as the dystonia. And my intention is to calm the nervous system, to relax the muscle, relax the entire body first. And by doing that, it has really a domino effect. When the muscles relax, the blood vessels dilate, and then you have more blood flow and circulation throughout the body. And because of that improved circulation, you're actually reducing the tremors that you often have with Parkinson's. So the nervous system just immediately is relaxed. And with that, you also have improved sleep, and sleep deprivation is really, the disorder of not having that restorative sleep. And to speak to Chris's comment about, that to have that ability to pursue your exercise program, sleep is critical. And so massage, number one, induces a very deep restorative sleep, both on the table, but also days later. Like I have many clients who say, Lisa, I don't know. I don't know. I was in the deepest sleep that I have experienced, I haven't experienced in a long time. And with that, you have the ability to perform and mentally focus. But another piece of the hormones involved, the endorphins that the massage releases, the happy chemicals, the serotonin and dopamine, and the reduction of the stress hormones. So the stress hormone cortisol is really high in most of us today, but especially with those who can't relax their muscles. So by reducing the tremors, by promoting more relaxation in the muscle, you have that increase in the dopamine. And actually a study in 2005 with the Touch Research Institute in the International Journal of Neuroscience showed that after a massage, there was a reduction of 31% of the cortisol, the stress level in a person after receiving massage. So that alone just will give them the energy to have a more productive, quality of life.
Yeah,
and
absolutely. I think you made a lot of important points there. Definitely if our patients are sleeping benefit, there's a huge sleep benefit with Parkinson's. So not only from a motor standpoint, but a cognitive standpoint as well. So getting our patients to proper sleep. And if you're having a lot of dystonia, muscle cramping, a lot of pain, that's going to affect the sleep. And a lot of times our medications aren't good enough to relax that dystonia. So deep tissue massages can be really beneficial. Sometimes patients undergo dry needling as well. It could be so severe. And sometimes we will even use botulinum toxin therapies. But the problem with the botulinum toxin therapies, they don't always last. So it has to be done every 3 months. So a lot of times we're seeing our patients receive botulinum toxin therapies together with massage. I mean, it's a wonderful combination, especially when the toxin starts to wear off. So it really is an area, and pain is something that I think is often overlooked in Parkinson's. And pain could be one of the first presenting symptoms of Parkinson's and a sign of the medicines wearing off. But the cramping, the dystonia can cause so much debilitating pain that we do have to find ways to improve the quality of life of our patients. There could be multiple benefits from receiving these therapies. So a lot of great points that you brought up. Lisa, now going back a little bit to the telehealth, since we're doing so much of this now. So can you do the big program through telehealth? And if you are doing the big program through telehealth, do you need somebody else with you there?
So yes, we are doing the big program over telehealth, but I don't recommend it for everybody over telehealth. Before I agree to do big over telehealth, I do a physical therapy evaluation to look at your strength, your walking, your balance, and look at what your goals are for physical therapy. If I deem the big program appropriate, but you are very high level, you're walking every day with no assistive device, you're regularly exercising, I'd really want to challenge you. I'd want to put you on a BOSU or a foam pad or a Swiss ball, and I can't do that because I can't stand behind you to recover your balance. If there's someone at home that you feel comfortable that could kind of guard you for balance, then I would feel more comfortable doing the big program. So I think it really depends on what your goals for the program are. If you feel comfortable coming in and you would benefit from that equipment, I'd recommend that you come in. If you don't feel comfortable, we can work with a caregiver at home. The big program also works for people that need more assistance or walking with canes, with walkers. We can hold on to countertops or, do some of it sitting. It's not always a standing high intensity program. So there's a lot of variation in the program and how we can modify it to the person's individual needs.
Excellent. I want to remind all our attendees, and I hope you're enjoying the program thus far. We do have a question and answer on the bottom panel. So if you want to ask some questions, you're more than welcome to, and I'll be getting to those shortly. And I see that we've gotten a couple of questions, so I'll definitely get to them shortly. So Karen, sialorrhea or drooling is something that we often see in our patients, and we now have 2 therapies that have been FDA approved for adults with sialorrhea. Prior to that, we really didn't have any pharmacological therapies that were labeled or FDA approved. So we have botulinum toxins that we can use. Besides using botulinum toxin therapies, what are some of the techniques that you'll teach patients to deal with excess saliva or drooling in our patients with Parkinson's disease?
Sure. So some of the things that I think are important are first, again, that swallowing evaluation is important to get current level of functioning. Also, maybe a physical therapy or occupational therapy evaluation to look at posture and how that plays into drooling. Other practical tips are carrying water with you, taking small sips throughout the day, which will encourage more frequent swallowing. And then also gum chewing, sucking on sugar-free candy. Again, all of that encourages the increase in the rate of swallowing, and which will help reduce the impact of excess saliva.
Thank you. And I like the fact that you brought sugar-free candy, because that actually brings me to one of my next questions. I've often heard some of my patients, and I've heard one of the questions that I did receive was, I often see that when my husband eats too much sugar, he doesn't do as well. And I've also heard some patients have dyskinesias. Chris, as a personal trainer, do you get questions about diet and maybe free sugar? What does it do to exercise? Do you teach patients on proper nutrition? Is that part of being a personal trainer?
No, exercise is really, it's a separate, you can be a trainer on one hand and a nutritionist, but I'm sure a lot of trainers have opinions on nutrition, but they're not trained as nutritionists.
Well, do you have any opinions, for example, on how you see how the diet of an individual is? And I'll also open up this question about nutrition to anybody else if they want to comment. But do you see the simple sugars interfere with exercise, for example?
What I've seen is, my diabetic patients, it's really obvious. When they're getting too much sugar, they just begin having other types of symptoms, like digestive symptoms, sleeping issues, things like that. So I can't say that I've done the research on this, but you can see clinically, that happens to the diabetics clearly.
Well, I think you bring up a great point there, because we do see a lot of comorbidity with diabetes and Parkinson's. And actually, when the sugars are very poorly controlled, we do see that our diabetic patients with Parkinson's do much worse. And we do see some people without diabetes who just eat a lot of sugar. We do see some motor control problems. And in fact, there's a lot of research right now looking at diabetic medications as potential disease-modifying therapies. And there was one large phase 2 clinical trial using a drug called exenatide, which modulates the sugar within the plasma, and is a drug used in diabetes. And patients without diabetes who received this treatment had lower unified Parkinson's disease rating motor score. So their motor function was better on this medicine, keeping the sugar levels a little bit low. So nutrition definitely is becoming an area of intense research in Parkinson's disease. And that sugar, that the free sugars, I think, not only is it a concern in Parkinson's, but other neurodegenerative disorders. So we're seeing signals of this as well in Alzheimer's disease, for example. So nutrition definitely does play a big role, and sometimes large doses of protein can interfere with the absorption of our main medicine, the levodopa. So making sure that patients are properly, they have proper nutrition. And a lot of times when our patients are under medicated, we see a lot of weight loss, and that can be a big problem. And then sometimes if we over medicate or cause some impulse control disorders, we can see our patients gain a lot of weight because there is a higher propensity to sugar sometimes for these patients. And then it's kind of a snowball effect. So nutrition is something that we definitely have to pay a lot more attention to. I'll be the first that sometimes as doctors, we're not the best nutritionists either. In fact, our medical school class of nutrition lasted 2 weeks. That's a big problem in medical school. You gotta go back and change that. So hopefully things have changed a little bit over the last 20 years. But this is an area that we really need to take a look a little bit further. I'm going to ask this question to Lisa. There's a patient who needs a lumbar fusion surgery. What kind of problems would having lumbar degenerative joint disease or probably a lumbar radiculopathy trying to do some of your therapies? And we know that exercise is very important. So could this be a problem if this area isn't fixed or treated?
So ideally, we would like to treat the lumbar radiculopathy first, but we can, work with it. We can safely exercise and not increase, as long as the symptoms don't increase in the leg, we're not making anything worse. But ideally, we would treat the lumbar radiculopathy first to get the most benefit from the Parkinson's specific exercise program.
So there could be physical therapy that can
Correct.
help the situation as well.
Correct. So, there's physical therapy for all sorts of orthopedic conditions. We do see people in big and in traditional physical therapy with Parkinson's and orthopedic restrictions, whether it's knee pain from, arthritis or back pain or whatever it has been. And we try to work around that, and whether we can treat it ourselves or we refer to one of our orthopedic therapists here at Georgetown to work as a team, to work on the whole body, so then you can get the most out of the exercise for the Parkinson's specific exercises.
So one of the questions, and I'll open this up to the panel if they have any insight, because I've heard some great input from all of you, is there a particular exercise that a patient should be doing, and how does exercise for really slow down the progression of Parkinson's? So any insight from anybody? Who anybody want this particular question? Okay, Lisa, you go ahead.
So I think what I usually say to people is exercise is neuroprotective. It protects the dopamine in your brain. So the more exercise you do, and like Chris and I were saying, repetitive, frequently intense, that's going to protect the dopamine in your brain. And you want to do a variety of exercises. You don't want to do the same exercise routine day after day after day, because your body just adapts to it. You want to be constantly doing novel exercises to really challenge your brain, try to challenge your motor control system. As far as, is there one exercise that everyone should be doing? No, because not everyone is the same. However, I think one important area to focus on is postural exercises. really working on posture, because posture impacts so much. It can impact eating, swallowing, dressing, balance. So I think posture exercises overall are great, and then linking up with a trainer or a physical therapist to get more specifics for your personal self.
No, I think you, go ahead, Karen.
So I just wanted to talk about a little bit about exercise in terms of voice and swallowing. So in terms of the loud program, we know that doing the loud program helps improve voice production and speech production, but it also has benefits to improve swallowing function as well, which is very critical because a large majority of patients with Parkinson's will eventually have swallowing difficulty. So in order to, again, doing that preventative medicine, I think early on is really important, even for speech and swallowing. And we know this, the research backs this, critical.
Yeah, I think you both bring up excellent points, and you know, a lot of times I do advise my patients, you know, that you're doing the right amount of exercise, that after you're doing it, you're feeling good. If you feel completely exhausted and you're wiped out for the rest of the day, it's not, you could be overdoing it for some people, so that you feel good because you did it. And you're right, it does increase the dopamine. We've seen the dopamine active transporter increase after exercise, so that recycles and reuses your dopamine. And like we talked about some of the research projects we've done, it looks like we doubled your dopamine sometimes when you do these therapy programs, et cetera. So it is the one thing that continues to show the benefits of neuronal protection, and even not only in humans but also in the animals. So you take a mouse with Parkinson's and one exercises and one doesn't, the disease progresses much slower in the one that does exercise daily. So very, 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 very important. The question that has also come up is, besides COVID, Lisa, is there a reason why a patient cannot get a massage? Are there reasons why they cannot get a massage?
Well, absolutely. I would never give a massage to anybody who's running a low-grade fever, for instance. I mean, there's something brewing in the body. And my massage is going to promote circulation. It affects the lymphatic system, which removes waste from the body. And you don't want to tax a system that's already compromised. And massage, as much as there is evidence that it boosts your immunity, there are people, whether you have Parkinson's or not, like just across the board, there are precautions. So perhaps like if somebody's immune system is compromised due to cancer, you could still do body work, but it would be adjusted and modified. Like there's certain energy work or heal, like Reiki versus manual, like deep tissue massage. Somebody might want to consider cranial sacral therapy from either PT or a skilled cranial sacral therapist, where it's very gentle, but yet very profound as far as the benefits. If somebody has any obvious skin lesions or rashes, you don't want to go, you don't want to massage that extremity or area for sure. And then, if somebody has swallowing difficulties, I often have to make modifications, propping the head up during my treatments. I don't want them to lie flat, especially if they have some issues with blood pressure. I make sure that, when they get off, or if medications have recently been changed, I always try to ask my patients before they come in, like, have there been any changes to your medications? Because I want to be aware massage will affect the way you feel and how you receive, how the medications work in your body. It's that, powerful. So although I encourage everybody to get a massage, there are clearly precautions or contraindications. Infection, clearly, even if it's a cold, if a client tells me, I have a cold brewing, I usually say, please don't come in. Like, I'm just going to make you feel worse before you feel better. And to protect myself as well as my other patients who might enter the same room, it's best that you wait till you're clear. But other than that, like it's just a communication between your practitioner, and you keep a safe environment.
Yeah, absolutely.
Yeah.
Thank you. So, Chris, one of our panelists has asked a question. Apparently, they do partake in some of the Tai Chi classes that you do teach, and they've noticed that after they finish their Tai Chi, their tremors are better controlled. Have you heard other Parkinson's patients reporting this as well? So we did talk about the balance, but how about the tremor?
Not directly in relation to Tai Chi, but I know that some of my patients, just after a regular exercise session, seem to have fewer tremors. So I imagine there's kind of a crossover just because it's exercise in general.
Yeah, as we've learned, the dopamine levels can raise, the DHT transport can increase, so you can recycle, keep that dopamine around a little bit longer. So you can see motor symptoms improve after exercise. And not only Tai Chi or physical exercise, but I've heard it from some of my patients who do the boxing or dance. And in fact, there's been videos of individuals that they go to dance therapy and they can't walk, but they do their dance therapy, and after the dance therapy for the next hour, they're walking much better. Yeah, and they weren't really able to walk prior to the therapy. So there is a significant benefit from these different types of exercise. Again, every patient is different, so you really have to individualize the potential treatment for or exercise program for each individual patient. There's also another question coming in about the loss of taste, and is that and I don't know if Karen, do you want to take that? Do you hear that from some of the Parkinson's patients, the loss of taste? Do you ever, again, some of the times it could be because of poor dentition or drooling, but it could be due to other reasons as well.
Right, and I think it's definitely a reason that contributes to weight loss, which is something that I definitely talk to my patients about in terms of what their current weight is and if they've lost weight. We talk about ways to think about maximizing their nutrition, perhaps seeing a registered dietitian. I think all of those things are really important. Having nutritional supplements, things like that, because I think it's very important to keep weight on as the disease progresses.
And it's common because you also see the loss of smell in a lot of our patients, and that can decrease the appetite as well, and the decreased taste. I do sometimes see that some of our patients start liking spicy food because the back of the mouth can still taste some of that spiciness, or also seeing people just have a predilection to sweets because they can still taste that. So definitely the appetite could change, especially if you don't taste the same way or smell the same way as you used to. So these are different issues that can occur. We also do have a question about, is the immune system compromised when you have Parkinson's disease? This is a question that's coming in from one of our panelists as well. And maybe one of the reasons why this question is coming in is because of the pandemic. And we have about 10,000 Parkinson's disease patients in our clinics throughout our movement disorder program throughout the whole MedStar system. And really so far, I think we've seen about 3 patients come down with COVID-19. Luckily, knock on wood, everybody's done well so far. We definitely, most of our patients are at increased risk, especially because of the age and especially if they have diabetes. But the immune system, generally speaking, is not compromised to the extent as other conditions like other immunodeficiency syndromes or the medicines are given for multiple sclerosis to decrease the immune system. In fact, if anything, we do see that the immune system is hyperactive in Parkinson's. So you have a lot of cytokines already elevated. So there's no true compromise per se, but there is some immune dysfunction that is occurring because of the cytotoxic sticky proteins that accumulate in neurons, leading to neuronal dysfunction. But again, we're learning a lot. And one of the things that we're following closely is when we had the pandemic flu back in the early 1900s, 1918 was called the Spanish flu. It's also called encephalitic lethargic or von Eckmo's encephalitis. Patients who survived that flu actually were set up and developed Parkinson's. So if you look at the movie Awakening in the 1960s, a lot of those patients who were institutionalized with Parkinson's were survivors from the pandemic. So that's something that we're going to be following in neurology very clear to see what happens after that cytokine storm that can occur a couple of weeks after developing COVID-19. So we're going to learn a little bit more about that, but we have seen pandemics or viral viruses cause Parkinson's, but actually since the 1960s, we haven't seen any post-influenza Parkinson's, but there is a history of that. So we are going to learn a lot more about those particular conditions. So we're getting to the end of our hour, and I just want to I want to thank our panelists. I think our panelists have been superb, very knowledgeable. You know, I thank you from the bottom of my heart for everything that you do for our Parkinson's patients, our Parkinson's community. We continue to learn, but I think this panel is a great example of all the different therapies that are available to our patients, and how really each patient really has to be individualized in treating each individual person. So no two people are the same. So I think we went through the majority of the questions. One of the last questions that I was asked was about DBS. Is deep brain stimulation still for late stage Parkinson's patients? And actually what we've learned so far with DBS is that actually it's available for patients within 3 years of the disease, especially if they're having motor fluctuations or the motor symptoms aren't well controlled. So it's not only an advanced therapy at the end of the disease. We definitely do it much earlier, and we can do it as early as 3 years since diagnosis. So, and that's, as you heard, it's really important to do earlier intervention for physical therapy, earlier intervention for speech therapy, earlier intervention getting the exercise on board, and if the symptoms are well controlled, doing things for mental wellness and massage are very important. So not waiting to the end, so being very proactive. So again, I want to really thank the panels, who I hope has taught not only our patients and our families some, but they've taught me a lot tonight too, and the importance of really working together for each individual patient, individualizing the therapy. And I want to thank everybody who has been with us this evening to learn a little bit more about exercise, the therapies, nutrition. We'll have to work a little bit more on nutrition. I know there's a couple other questions, but our time is short. But thank you for helping me teach the next generation of movement disorder specialists. So, and that's what the fellowship program is about. What a wonderful investment that everybody is making to be able to help us train the next generation of neurology to really treat each individual as an individual and find the best cutting edge medicines and treatments for that individual, because we continue to progress, and we've seen what great progress we've made, not only in the therapeutics, but also in the allied health as well over the last decade. And one example of one of our fellows, who's now my colleague and a movement disorder specialist, and took advantage of this great Fund the Fellow program, the fellowship program, is Dr. Torres Yagi, who's going to finish the program for us tonight. So thank you. God bless everybody. Stay safe, and look forward to the next program real soon. And thank you for the panel. What a wonderful panel. I'm blessed to be surrounded with this great group and to work with wonderful people every single day. Thank you, and hand it over to Dr. Torres Yagi. Good night.
Thank you so much, Dr. Pagan, and to all the panelists today. this evening. You know, it really is a pleasure for me to be able to speak on behalf of the Funda Fellow team, not only now as an attending after having finished my 2-year training in movement disorders, but also as a young preschooler. You know, it takes 32 years, including preschool, to finish your Funda Fellow Movement Disorders Fellowship. That was my joke at the my graduation, that Dr. Pagan finally handed my diploma. I was so excited because I had no more standardized tests. I could finally focus on my patients and work closely with Dr. Pagan. My fellowship truly isn't over. I am still working closely with Dr. Pagan. I ask him about cases all the time. I make him come out of his office. I say, Dr. Pagan, can you please take a look at this person walking down the hallway and give me your expert opinion on, strategies on how to adjust the deep brain stimulator. Mentorship is lacking, and in movement disorders and in neurology in general. I can tell you when I go to the international meetings, after having finished this Funda Fellow fellowship, I can't tell you how happy I was and how grateful I am to everybody listening to be able to have come through this fellowship. I am able now to reach our patients. We said we have close to 10,000 patients. Dr. Pagan and I are able to help in any way we can with clinical research, continuing the idea that we might be able to actually modify the disease, not just treat the symptoms. Right now, we used to say the future is bright, but the present is bright for Parkinson's disease care. We have so many different therapeutics. We have so many different non-pharmacological ways of treating patients, like we talked about today. Exercise can be disease modifying. Everything that we've mentioned can actually modify the disease, and that's what's within our control. What we can do through this fellowship is continue to train movement disorders doctors like me. I stayed because I told Dr. Pagan, can I do 5 more years of fellowship? He said, no, you have to get started. Jump on that treadmill and don't come off. I said, all right, fine, we'll do it. But I'm loving every minute of it. I love working with Dr. Pagan and working with the other 9 movement disorders doctors that we have. We have 5 fellows. It's incredible the amount of research that we've done, especially during the pandemic. We were just talking about all the different publications that we've had in big journals coming from our institution to be able to continue to develop the different therapies and clinical research and all the new things that we can talk about just based on our own population of patients. So this Funda Fellow program is so powerful. It is so valuable. The 5 fellows that are going to come through and they're listening, I know they are learning a lot. And when they're out there in the United States, one is going to Colorado, the other one's going to California. The next 3, we don't know where they'll be, but hopefully we'll keep a few around us, right? So I just wanted to thank everybody. And I want everyone to feel empowered with a group like this. It really is a very unique group of people, to be able to come together, mobilize, congregate, and get as much as Dr. Pagan has been able to get done. And being able to follow in his footsteps is something that I couldn't have dreamed to have a better program to continue to work in. So thank you, everybody. This really is a touching experience. I was actually having a deja vu because I remember this panel. When I was a fellow, I came to the Funda Fellow presentation at Levy Center when we were doing it back pre-COVID. Hopefully we will get back there. But I still remember these panelists talking and saying things, and now listening to it from a different perspective as an attending it's just wonderful. And so I'm so glad to hear everybody here, and thank you for everything. I couldn't have become, the last 2 years of that 32-year journey, I couldn't have done it without Funda Fellow, Dr. Pagan, and this group. So thank you so much.